Welcome back to my channel. This is your friend No Solution. This is a page that you can get all your various health tips. So tonight we want to talk about how to prevent stroke. If you have high blood pressure, you have to work closely with your doctor to keep your blood pressure in check within the healthy range. Medication and healthy lifestyle changes such as regular exercises and eating healthy can also help you in prevention of stroke. Stay away from smoking or people that are smokers. You double your risk of a stroke if you use tobacco because nicotine in cigarette raises blood pressure and carbon monoxide in smoke lowers the amount of oxygen your blood can carry per time. Even breathing secondhand smoke can raise your risk. So chances of a stroke. So you have to be wary of secondhand smoke. That is, secondhand smoke is when you are staying with somebody or you are being exposed to smoke that you are not smoking yourself. Tobacco can also raise the risk of a blood fat called triglyceride, which lowers your level of good cholesterol, that's the HDL, and make your blood sticky and more likely to clot, and they make plaque build up more likely, and thicken and narrow blood vessels and damages their linings. So of course you have to manage your heart. You have to manage your heart. An irregular heartbeat called atrial fibrillation is behind some stroke caused by blood clots. Atrial fibrillation make blood pool in your heart where it can clot. If that clot travel to your brain, it causes a stroke. You can have atrial fibrillation because of high blood pressure, plaques in your arteries, heart failures, and other reasons. Cut the booze. Too much alcohol can raise your blood pressure and your triglyceride. Limit yourself to no more than 2 drinks a day if you are a man, and 1 drink if you are a woman of alcohol. Health is well, remember? Because drinking too much can cause atrial fibrillation too. Binge drinking like 4 to 5, downing like 4 to 5 within 2 hours can trigger an irregular heartbeat. You know, all these are chemicals. Control your diabetes. High blood sugar can make you 2 to 4 times more likely to have a stroke if it is not well managed. Diabetes can lead to fatty deposit or clot enter your blood vessels. This can narrow the ones in your brain and neck and might cut off the blood supply to the brain. Then you should be able to exercise. Being a couch potato can lead to obesity, so high cholesterol, diabetes, and high blood pressure. So what do you want to do? And all those things are a recipe for stroke. So get moving. You don't have to run a marathon. It's enough to work out 30 minutes, 5 days a week. You should do enough to make you breathe hard, but not off and puff. Talk to your doctor before you start exercising. Eat better food. Healthy eating can lower your risk of a stroke and can also help you shed weight if you need to shed weight. Load up on fresh fruits and vegetables like broccoli, Brussels sprouts, leafy greens, spinach, which are best every day. Choose lean proteins and high fiber food. Stay away from trans and saturated fat, which can clog your arteries. Cut salt and avoid processed foods. They are often loaded with salt, which can raise your blood pressure and trans fats. You understand? So, and you know what? You have to watch your cholesterol. Too much of this can clog your arteries and lead to heart attack and stroke. Keep your numbers, that's your blood pressure numbers, within the healthy range, and your total cholesterol should also be under 200 milligram per dl of blood. Bad cholesterol under 100 milligram per dl. Good cholesterol above 60 milligram per dl. Don't ignore the snore. Loud, constant snoring may be a sign of a disorder called sleep apnea, which can make you stop breathing at any time. It can make you stop breathing hundreds of times during the night. It can boost your chances of stroke by keeping you from getting enough oxygen and raising your blood pressure, thereby leading to stroke. And of course, you want to do well, take your medications. If you have already had a stroke, make sure you take your medicine according to the way doctor has prescribed you to help prevent another stroke. At least 25% of people who have had a stroke, who have a stroke, stop taking one or more of their drug within 3 months. So that's especially dangerous. So because you have to, that's when you are most likely to have another stroke. So don't stop your medication. An aspirin a day, a low dose aspirin every day may help prevent strokes and heart attack in people at higher risk. But actual benefit is considered to be small. It acts as a blood thinner, thereby preventing various blood clot from forming in the artery, particularly blocked by cholesterol and plaque. But it also carries a risk of internal bleeding, which can also be life-threatening. So aspirin, it is not for everyone though. So don't start taking aspirin without talking to your doctor first. Remember, health is wealth. Keep taking care of yourself and don't give someone aspirin if they are just showing signs of stroke like slurred speech or a drooping face, because it can make a hemorrhagic stroke worse. Instead, call the EMR right away. See you.